good, right?
Yeah, that's what the stomach doctor suggests.
Yeah.
At least once a day, at least once a day. Now, once all the waste products so here the waste products of this process include undigested parts. Um, let's get gross. Things like undigested. We cannot, for some reason, we cannot process corn, and it comes out exactly the same.
But I love it.
I love corn, but yeah, it is like the body does not like corn. It goes right through you. And so we should listen to it. But I love corn.
It has no nutrients?
So it has no nutrients, and it includes undigested parts. So that corn would be an undigested part. Also, have you eat like carrots and you eat them in big chunks? A lot of times you actually poop out the chunks of carrots because it's too hard. You need it, but if you blend it or you in soup or something like that, it doesn't happen. You also have seen like red peppers or things like that. Also, is something that we don't, for some reason, we poop out too. Yes.
But they say that corn can lead to colon cancer, right?
What is it?
That's what they say that corn can lead to colon cancer because the body doesn't process it.
No, actually, it makes you just move your poop out. No, but it doesn't. It's not really that. It's not related to colon cancer. No, but it is because it doesn't get processed. You just poop it out, so it doesn't do anything. So this is known as fiber, and also you get rid of all the older cells. They're in your intestines with a mucosa. Your body cleans out everything. Every day you get cleaned out. Every day. So the mucosa that was there this morning, when you poop, it goes right out. Old cells die. New cells go in. All that is a process constantly. We're constantly. The materials are propelled into the colon, where they remain for 1 to 2 days. It all depends on your digestive system. Some people, if they're more on the constipated side, will not move their bowels for 2 or 3 days. I know people once a week. That's pretty bad. That's not really good for you. While all this is inside of you, if you don't drink enough water, and normally constipation is due to the lack of water and fiber. So if you don't drink enough water, your intestines have nothing to work with, so it can't push it through with the water. So that's something that happens. So once you have a bowel movement, your intestines are all cleaned out, but the intestines contain billions, not millions, billions of bacteria. Yes.
So you were saying that the small intestine separates the different
It has
minerals, nutrients,
yes,
etc.,
yeah.
and decides what to send to the large intestine.
Yes.
So what tells the small intestine to do that? Is it an example of what's it called, automatic?
Yes.
Electrons from the brain, doesn't
Yes.
it?
Just like breathing or?
Exactly. The small intestine, that's his job. So since that's his job, he knows what to do. So and basically the different parts of the intestine, if you like what we were going in the book, have different jobs, like absorbing different things. So that's how they know what the job is. So it's already built in, but it's something automatically. Yes, like breathing and in the heart thing, it's automatic. Once the food gets in there, the small intestine knows exactly what to do, and different parts of the intestine absorb it. Like what I was saying, the laundry, you go this way, you go this way, it knows exactly what to grab. And what's no good, it goes to the large intestine and poops it out. So now, the colon, the large intestine, is
the same? The colon is the large intestine?
yes. It's 5 feet long. And it's not that long. It's compared to the small intestine that has many, many feet. And it's by the time the digested food reaches the colon, all nutrients have been absorbed. Everything has been absorbed by the small intestine. Vitamin K, some vitamin B, hydrogen sulfide, that's why we smell so bad when we pass gas. Methane also. are produced by the billions of bacteria that live in the colon. It's essential that when we go to the bathroom and we move our bowels, or we need to wash our hands afterwards, because any time that you're near the area, you're near poop, or was poop in there. Even if you wipe yourself with the paper, there's still the cells and the bacteria of the poop is in there. So you need to be very careful. That's why you have to wash your hands. And because then if you're going to go grab food and you eat, those billions of bacteria, now you end up with another stomach, what they call here stomach flu.
Or E. coli.
Or you end up with E. coli. Or you end up with a massive stomach infection. Or you start throwing up or having diarrhea because the bacteria is making you sick. And it's also essential to learn what we talked about earlier, teaching little girls to clean themselves properly. Because for us women, the problem is that it's so close to the vagina that if you clean the other way around, you're bringing in some bacteria from your rectum right into your vagina. So you always clean front, back, get rid of it. Front, back, get rid of it. You don't come back with it again, because if you do, you're pushing bacteria back into your vagina. And this is where you can end up with bacterial vaginosis or things of that nature. It smells pretty bad. The mucus secreted by the colon lining contains antibodies that protects the colon from disease. So just imagine, the colon has billions of bacteria inside, but it has something to protect it so it doesn't get infected. We are the most amazing thing ever. There's no machine like us. They have never been able to produce something like us. Just, never mind. Can't get into that one. You want to get me in trouble? I'm already in enough trouble as it is. I do it all by myself. Yes.
I have a friend, a very good friend of mine. She had a total gastrectomy, and I didn't know that there was good life after that.
Yeah. But you have to have the special feedings.
Yes.
Those are a pain. Because she has to do it like overnight thing. Does she do that, or what does she do?
It's been 4 years ago.
Uh-huh.
And yes, she has to eat 8 to 10 little small meals a day. And she lost a lot of it.
Well, that's the same thing that when we do, the gastric bypass, that's what we do. With the gastric bypass, we get rid of most of the small intestine. And we connect it in the upper part. And we also get rid of we leave the stomach that only fits 4 ounces. And so the stomach's usually left around this big, and we clipped everything out. And then we reconnected the portion of the intestine, small intestine there. But because, 1, we're missing the rest of the stomach, and 2, most of the intestine is gone, or a portion of it is gone, it doesn't absorb all these things that the small intestine does. So everything, it just goes right through. That's why they have to take vitamins all the time, because the hair can fall out, the skin drags, it gets very dry. So many things, you can get very sick from vitamin D, lack of vitamin D, your heart can have problems. So usually when we do a gastric bypass or removal of the stomach for cancer, or most of the stomach because due to cancer, one of the things that happens is that you end up with these kind of deficiencies because you don't have enough of the intestine, enough of the stomach to be able to work through this stuff. So we can do bypass where we cut. We can do a sleeve where we remove most of the stomach and we leave it long. Instead of being like this, what we do is we get rid of this, the whole belly part that crunches the food. So that's why you have to eat very slowly, munch everything really well, chew, chew, chew. And then because the stomach doesn't have the force, otherwise you poop everything out in chunks, like you did before. So those are the people that have bariatric surgery. Those are you can have a sleeve. The sleeves work really well because the sleeve, they can do it through laparoscope, 4 little tiny holes, and you just cannot eat like more than a small cup, and that's it. Like in the morning, and in the afternoon, but you need to take your vitamins because otherwise you're going to lack all your vitamins. If we remove the intestines, now in cases where we have to remove the intestine, the colon, the large intestine, if we have to remove it for any reason, for cancer, for an obstruction, one thing that happens sometimes is obstructions in the intestine. So sometimes due to scar tissue, to inflammations in the intestine. And so let's say there is a scarring in the intestine, you had an inflammation before, some sort of infection, and then later on, all of a sudden you can't go to the bathroom, and you start having stomach pains, and you haven't gone to the bathroom for a week. And normally you go every day. This is an obstruction. So our job is to get in and try to find the obstruction. Because the obstruction could be many things. It could be the scar tissue that is blocking the stool and not letting it go through. It could also mean that your intestines started to die. That the blood that flows through the intestine is not flowing anymore. It's not flowing properly, and you will die. It's pretty, you don't last too long and your intestines start dying out. You also may have, I'm sorry?
Cancer.
Yeah, cancer. The reasons that we remove a lot of times the intestines are due to obstructions, they have damaged the intestine already, or cancers. Guys, so one of the, when we have the cancer, like in the large intestine, what we do is we put that part of the large intestine and we do a stoma, S-T-O-M-A. Okay, and we put it in there and we build it. It looks like a belly button, like that. It is like this round. It all depends on the person's body, and not all our intestines are the same, meaning in sizes. They're large intestines, but everybody's bodies are different. So there may be a larger or a smaller one. And then what we do is, this is how we're going to measure it when we put the bag on top of it. So all the stool just automatically comes out into the bag. Nowadays, in the bags that we use for stomas and these kind of problems, they have filters, so it doesn't smell, because we have no control over what is coming out constantly. So when this happens, then you go to the bathroom the same way. You go to the bathroom, just, when you feel that it's getting full, you open it up, you square it in the toilet, close it, clean it, put it back in, stay. That's it. That's how we do it. But it normally doesn't smell. Because what makes it smell really bad usually is the amount of feet that we have with the colon with all that bacteria. So it does have some smell, but it's not as strong as our normal poop has.
So that person will use.
No, the rectum gets closed. We sew the rectum up. Sometimes you may get some mucus out of it, a little bit, because the rectum's supposed to clean itself. So occasionally you may get a little mucus, but that's all. The connection will be all up here for the rest of their life. Sometimes we can do it temporarily. Sometimes if we saw an obstruction and we had to remove a good portion of the intestine, but it's too much inflammation going on, we will do a temporary reconnection, and we put it up here, and we do it for a few months or weeks till the intestine goes down. Usually it's months, till the intestine calms down. Once it calms down, then we're able to reconnect the intestines again and see if they work all together. Most of the time it works really well. Occasionally it doesn't, and the person has to stay with the stoma and have the bag for life.
So a stoma really is just an opening?
An opening.
Because it's also, this one is also
This is
called
also a stoma. Anything that's an opening going into the inside. Yeah. Okay, guys, I just realized it's 1:10, we have gone to lunch. Let's go to lunch, why don't we come back at 1:45? All right?